Good Friday morning, too. And the doctors this week, Dr. Todd Bell joins me. We're talking about something that's been in the news a lot, the confirmed TB case that was at Fannin Middle School. Something I know you can't talk specifically about that case or that school, but just something as parents, if they're wondering, is this something they should be concerned about or their kids at home? What should parents know? What should they look for type stuff?
Well, you know, I think that it's important to know a little bit about the basics of tuberculosis. So tuberculosis, it's an infectious disease. It's not as infectious as a lot of viral things. You think of chickenpox or the flu are very easily spread from person to person. Tuberculosis certainly can be spread from person to person, but it's not as infectious as what some of those viruses are. When someone is exposed to tuberculosis, if it's a large enough of an exposure, they can get infected. But even folks who have an infection from tuberculosis, most people don't immediately develop symptoms. They develop what we call latent TB, and that's just a period of time that sometimes can last for years, where the person has been exposed, but the immune system has been able to fight it off. Now, a few people will then go on to develop active tuberculosis that can be spread again to other people. It's important, though, to think about that latent TB component, because that gives us an opportunity to be able to treat with usually just one medication, as opposed to treating active tuberculosis where people have symptoms. We have to use more medications. That latent TB is a time period that we can identify folks who've been exposed, treat them before it has a chance to spread on to somebody else. I think it's also important to know that in tuberculosis in children, even with active tuberculosis, the infectivity is not as high as it is in adults. So it's the adults that we see that are the ones who are most likely to be able to spread it to other people. And then, of course, that spread is dependent on the length of time that somebody spends with someone who has tuberculosis. So if I have tuberculosis, my wife is going to be at a higher risk of getting tuberculosis than someone that I just spend an hour a week at church with.
So someone you passed in the store maybe the past couple of weeks, it's not typically you're going to
That would be virtually no chance of it being passed with those really brief types of exposures.
Okay.
But that we do the case investigation, or the health department does the case investigation, and they basically expand those circles, looking first at those people that have had the most exposure to the individual.
And real quick, the symptoms to look for.
So with active tuberculosis, the symptoms are typically things like a cough, sometimes night sweats, low-grade fevers, especially low-grade fevers and coughs that don't go away. On the other hand, with that latent tuberculosis, there aren't any symptoms, and it's only if you know that you've been exposed that we would even test to see.
All right, something we'll continue to hear about. Thank you, Dr. Bell.